the Chemistry in its Element podcast. Curious tales of chemical compounds.
Most of the potential COVID-19 treatments that we've looked at on the Chemistry in its Element podcast have been evaluated on their ability to treat severe disease, drugs that can prevent deaths, reduce time in intensive care, or get people discharged from hospital sooner. And in the peak of a pandemic, that certainly makes sense. But we've said little about drugs that can treat milder cases, those that don't necessitate a trip to hospital. New clinical trial data suggests that Favipiravir, a drug licensed in Japan to treat influenza and also known as Avigan, may significantly reduce COVID symptoms and viral load in just a few days. Favipiravir seems to be effective against a wide range of viruses, including well-known ones like influenza and norovirus, but also alphavirus, filovirus, arenavirus, and the flaviviruses responsible for West Nile fever, dengue, Zika, and yellow fever. It works by preventing viruses from replicating through inhibiting RNA-dependent RNA polymerase. That's a similar mechanism to remdesivir. Taken orally, it's what's known as a prodrug. It's metabolized into its active form once it's inside the body. It seems to have relatively few side effects, with one major exception. It can cause significant defects to a developing embryo, and so should be avoided by people who are pregnant or are trying to become pregnant. In the aftermath of the fatal H5N1 epidemic in Hong Kong in 1997, demand grew for medications that could treat new strains of influenza. A joint effort between Fujifilm's Toyama Chemical Co., Hokuriku University and the University of Toyama screened 30,000 candidate molecules for biological activity, looking for antibacterial, anti-inflammatory, immunomodulatory and antiviral properties. One, a derivative of the tuberculosis medication pyrazinamide, known as T705, compared favourably with established flu drug oseltamivir, which you might know as Tamiflu. One big advantage of Favipiravir is that it seems to be relatively difficult for viruses to become resistant. In lab studies that actively tried to develop resistant influenza, researchers struggled to evolve a virus that was both resistant to the drug and capable of enough reproduction to become the dominant virus type. There's also no evidence of resistance developing during clinical trials, something that has been seen in trials of oseltamivir and other antivirals. That's not to say it can't happen, of course. Mutations have been identified that offer protection against the drug, but at a cost. If another mutation can compensate for the loss in viral fitness, then resistance could evolve. Life, or in this case an organism on the edge of life, finds a way. It may come as a surprise then that Favipiravir is not widely licensed for use against influenza. The risks in pregnancy may have been enough on their own to cause most countries to stick to their existing flu provisions. Even in its home country of Japan, it's licensed only as a treatment for novel or re-emerging strains of influenza, not for the seasonal infection. That's not to say that it failed as a medication. In 2017, Japan created a stockpile of the drug, enough to treat 2 million people in the event of an influenza epidemic. In a pattern that's now probably becoming familiar to COVID treatment trackers and podcast listeners, Favipiravir has also shown promise in treating Ebola. In 2014, a French volunteer nurse who contracted the disease in Liberia recovered after receiving Favipiravir alongside other experimental treatments. But initial trials showing positive results in mild cases were criticised for poor experimental design. Ebola then, as was the case with remdesivir, leads us to SARS-CoV-2, the coronavirus responsible for COVID-19. Chinese clinical trials showed Favipiravir to be, and I quote, clearly effective. Patients tested negative for the virus in an average of just 4 days, compared to 11 days for controls. Symptoms improved alongside reduced viral load, with lung function improving in 91% of patients on the drug versus just 62% of those without. In a Russian trial, body temperature in 68% of patients on Favipiravir returned to normal in half the time of those in the control group. A trial in Japan, however, showed limited effect in people with a higher viral load, suggesting it's most likely to be of use in mild to moderate cases. Trials are also underway worldwide, exploring the efficacy of Favipiravir alone and in tandem with other drugs. The promising results so far have led to a spike in demand. Thailand have ordered 400,000 tablets from China and Japan. Germany are said to be purchasing millions, while companies in China, Russia, Bangladesh and India are amongst those producing their own supply of generic Favipiravir following fast-tracked approval. It's now been more than 8 months since COVID-19 was first identified. Over 17 million cases have been reported and nearly 2,000 clinical trials undertaken worldwide. In that time, we've seen the rise and fall of a number of promising treatments. Favipiravir is on the rise. Will it be the next promising candidate to fall? Next week, Mike Fremantle on gypsum and a fantastic discovery in Mexico.
One of the geologists who subsequently visited to research the cave described it as the Sistine Chapel of crystals. The crystals were up to 12 meters long, 4 meters wide, and 55 tons in weight. They are thought to be the largest natural crystals in the world.
Join Mike next time. And many thanks to Jeff Silver for suggesting that we take a look at Favipiravir. Jeff certainly seems to have demonstrated some foresight when he got in touch back in April. If you would like to suggest any compounds for us to cover, email chemistryworld@rsc.org or tweet @chemistryworld. And you can find all of our previous pods at chemistryworld.com/podcasts. I'm Ben Valsler. Thank you for joining me.